What if I told you that up to 60% of people have a genetic variation that makes it nearly impossible for your body to break down the vitamins that you're taking on a daily basis? Okay, so now what? It's also the same genetic variation that can explain your child's ADHD, their anxiety, their mood swings, and their sleep issues. So today we're going to dive deeper into the MTHFR gene mutations and why this might be the missing piece in your child's mental health puzzle. Hi, my name is Danielle Orr, and I am a family nurse practitioner, a psychiatric mental health nurse practitioner, a functional psychiatry coach, and a mom of two kiddos, one with neurodivergence and the other with Down syndrome. And I'm here to talk to you today about what some cutting edge science and really information that healthcare providers are not providing out there. Very rarely have I heard providers talking about it. And this really can be the key to understanding why your child is struggling despite all the efforts and everything that you've tried with them. So it's going to be an educational video. So make sure that you grab a notebook to take some notes because by the end of this video, you will understand exactly what the MTHFR gene mutation is and how it affects your child's brain and what you can do about it. So let's start with the basics. MTHFR stands for methylene tetrahydrofolate reductase. I know it's a mouthful. It's hard for me even to say, but we need to know it because it's important. So we're going to call it MTHFR. And that gene is what produces our instructions on how to make an enzyme. And so the enzyme is crucial in the process of really methylation. And what that means is that your body needs that to activate B vitamins, and particularly the folate and the B12. And so think of it like this. Folate and B12 are keys, and the methylation is a process that's actually cutting those keys for the locks that you need to unlock the door in your body so that your neurotransmitter production can do its job. And those are things like DNA repair, detoxification, and the neurotransmitters. And so if we're not able to have good function in those, we're not doing great as far as things go and really our body working efficiently like a well-oiled machine. And so here's where it gets interesting. The two main variants for MTHFR mutations are C677T and A1298. And so you don't have to worry about memorizing those numbers either because I'm going to let you know what you need to know about them. But basically what that means is if you have a copy of either mutation, that means that your enzyme function is reduced by about 30 to 40%. If you have two copies of the same mutation, your enzyme is reduced by 60 to 70%. And if you have one copy of each, it's a compound heterozygous, then you are also significantly affected. And so what that means is that, and I can tell you as a provider, I have seen the gamut. I have seen all different reductions. But what that means is that our kids are struggling. And so here's the kicker. Studies show that 40 to 60% of the population have at least one MTHFR gene mutation or gene variant. And that isn't rare. It's actually super common. So now let's talk about why this matters. So your child's mental health and behavior matters when it comes to MTHFR gene mutations. Because when the enzyme isn't working properly, there are several critical processes that get disrupted. So the first is the neurotransmitter production. So your child's brain needs to be properly methylated and have that folate to help produce serotonin and dopamine and norepinephrine. These are chemicals that are responsible for mood and focus and motivation and emotional regulation. I also talk about this a lot because these are things that our children need to thrive. And so we're having this big connection between our gut and our brain, and we have these variations. It's a problem, and our kids are struggling. So if your child has the MTHFR mutations, they may not be making enough of these neurotransmitters. And even if they're eating well and they're taking supplements, what it can actually show up in behaviors is depression or anxiety or ADHD symptoms, emotional regulation, motivation issues, sleep problems, all of these things just from having this variation. So the second problem with things that we know about MTHFR gene mutation is that there's detoxification part of it. So methylation is a crucial phase for our liver to detox. And so when children have this variation, they're not able to detox effectively. This means the environmental toxins, the heavy metals, the normal metabolic waste can actually build up and affect our brain function and affect their brain function. And I see this constantly. Children who seem more sensitive to things like food, environment, stress, chemicals, their little bodies are working much harder than they need to process these mutations because it's not working effectively. And everybody else seems to be handling it easy, but our kids are struggling. And so this is why it's so important. The third issue is histamine breakdown. So this is huge because most people don't realize is there is a connection. So methylation is required to break down histamine. Children with MTHFR variants often have a histamine intolerance, which can look like allergy or allergic type reactions without true allergies, headaches, migraines, sleep disruption, anxiety, panic attack, digestive issues, skin issues. These are probably things that if you look at it and go, oh, well, my kid has had some of these things going on, but you're not actually like adding them all up together, there could be big like warning signs for you guys. So the fourth is the DNA repair and cell function. Methylation affects how our genes are expressed and how they repair themselves. This impacts for anything from our immune function to our brain development to stress response. Here's an example. I have worked with a 9-year-old who was diagnosed with ADHD, anxiety, and ODD, or oppositional defiance disorder. His parents had tried multiple medications, behavioral therapy, and everything. When we tested him, he had the compound heterozygous MTHFR, which means that he had both variants, right? So he was still significantly impacted. His folate levels looked normal on standard testing, but his methylfolate levels were actually really low. Once we supported his methylation and got him on the right form of B vitamins, his focus improved dramatically. His anxiety decreased, and the oppositional defiance behaviors pretty much went away. Now, every child is different, but again, this one that I was working with. Remember, there can be more going on with your child's symptoms, especially if they seem to have multiple symptoms and we really can't find what's kind of going on with them. So here's why traditional medicine misses this most. Some doctors will test for folate or B12 levels, and if they're in normal range, they just assume that everything is fine. But what they're not understanding is having folate in your blood doesn't mean that your body can actually use it. Because again, those keys are not opening the door that they need to. If we don't have a key, it's like being there with all those keys on our keychain, trying opening, or oh no, this one doesn't fit, this one doesn't fit. And your body's doing this constantly every day. So yeah, we might have the folate, but it's not actually using the correct key to get in the door to open the pathways that they need to. And most supplements contain folic acid, which is actually synthetic. If your child has an MTHFR variant, they can't convert the folic acid into the active form that their body needs, which is the methylfolate. In fact, folic acid can actually block the receptor sites, which can make the problem worse. This is why I see children who seem to get worse on multivitamins or prenatal vitamins, and their parents think, I'm doing everything right. But really unknowingly, they're actually making the methylation problem worse. They just don't know any better. And that's okay. This is why I'm here to help you guys. So the same thing can happen with B12. So most supplements will contain a form of B12, but in children with MTHFR variants, it's not the correct form of B12. They need a specific kind that can actually help with their bodies and needing the active forms that their bodies can actually digest and use to make those keys and locks work together. So you may be asking, how do we figure out if MTHFR is actually affecting my child? So there's a couple of ways that we test this. We do genetic testing. So this shows me exactly what the variant is that your child has. And there's different ways that you can do this through functional lab testing. It is something that does need to most commonly be ordered by a coach or a provider for you. You can go through the 23andMe companies, but I really prefer a comprehensive panel that look at multiple methylation related genes and not just MTHFR, because it might just be a piece of the puzzle that we're not looking at the whole entire picture of. The other part where I come in is the functional testing. This is where we look at actually how the methylation works, how it's getting broken down in our child's body. And we can actually test for methylfolate levels, not just folate. And we can look at the homocysteine levels, which is actually seeing if it might suggest that we have a methylation problem. You can look at histamine levels and organic acid to show if there's any methylation metabolites. And really, it just looks at a much deeper level and a cellular level of your own child's function in their body. We can also do clinical assessments. So sometimes the pattern is clear that we make an educated guess based on decisions or symptoms that have been told to us or family histories, especially if our genetic testing isn't feasible. But really, I want to be clear that genetic testing will tell you exactly the variant that your child has. Functional testing will tell you how those variants are actually affecting your child and affecting their body. And with both of those pieces of that information are incredibly valuable to how to treat your child individually. In my practice, I often see children that parents have done the genetic testing through the 23andMe or any of the ancestry, those kind of things, and they've discovered the MTHFR variant, but they don't know what to do with that information. And that's where the functional testing and proper interpretation of the testing becomes crucial. This is the beautiful thing about the MTHFR variant is while you can't change genetics, that's not what we're trying to do, you can absolutely support the pathway. And here's how we do that. It's not just about taking more vitamins. It's about taking the right forms of vitamins. These are things that I really highly recommend that you talk to your provider about to ensure that you're taking the correct vitamins, because it's crucial. The dosing has to be individualized. And so some children need small amounts and other needs much higher doses. And these are better with certain ratios of nutrients. And this is why working with somebody who understands methylation is so important. We can do things like decreasing the methylation drains, things that really cause our body to just really build up that methylation or really reduce the rate that the methylation is being used in there. So gut health, food sensitivity, cleaning up our toxic environment, stress, physical, emotional stress. Those are really, really important. Certain medications can actually also interfere with folate metabolism. Detoxification can look different in every single kiddo. A lot of the kiddos struggle with detox, and we support this by giving glutathione support. We can do different things to work on their gut health, making sure they're having good bowel movements, really supporting their liver function. Working with dietary considerations, because that's really important too, because do need to talk about our kids' diet. And when I'm not saying you need to go on a diet, but just in general, the food that Americans eat are just not the best and healthiest and nutritious at times, right? We're fast environment, fast food. And I get that as a mom, it's hard, but really trying to make better conscious decisions on things. And so foods that are naturally high in folate can be helpful. Things like leafy greens, legumes, asparagus, but we also need to avoid things that have fortified folic acid in them, which can be really counterproductive. So some children need to limit their high histamine foods, which actually can cause issues with methylation. And so if we limit them, then our methylation improves. Again, these are all individual cases. And so I know people are going to be asking me, well, what do you suggest? It's all individual. And so there is no one size fits all when it comes to functional psychiatry. So let me share another case with you. I worked with a 12-year-old girl who had severe anxiety and depression. And she had been on multiple psychiatric medications with really just limited improvement and a lot of side effects. Testing actually showed that she had the MTHFR, the C677T gene, which is the homozygous, which means that she had 2 copies of that variant. So we started her on methylfolate and a good B12 supplement, and we supported her detoxification and addressed her gut health. And in them, within 3 months, her anxiety had improved so much that her psychiatrist was able to reduce her medication. Again, I do the coaching piece. I look at the functional side. I don't do the prescribing of medication for the patient. I work in support with their psychiatrist to work on the medication. They were able to decrease her medication because they were able to support her from the inside out, which is amazing. And her parent said that, gosh, it's like having a different kid. She's engaged. She's happy. She's sleeping better. And here's what the key with that. It wasn't just about the supplements that we changed, but we also looked at the whole entire picture, right? So her gut health, we looked at her toxic load, her stress levels, and her nutrition. And by doing all of those things and offering a really supportive environment for her, we were able to help her thrive. And I love that for my patients. And those are the outcomes I want with my patients. This is why it's so important to make sure we have the individualized care for our kiddos. Before you go and rush out and buy all the methylated vitamins, there's really some important things that you need to know when it comes to that. Start slow. Children, especially those that are dealing with methylation issues for a long time, can have really strong reactions when you are trying to support their pathways. It might make them feel worse and actually just not feel good. It's not just about MTHFR. So that is just one pathway that I'm talking about today. However, there are so many other pathways like our COMT or our COMT and really just the CVS and really all these other things that can affect the process. And so it's really important that you get that individualized testing for your child because it's comprehensive and we really do look at the whole entire picture for our kiddos. You need to work with a qualified practitioner. Methylation can be very complex. Too much can cause anxiety and insomnia and irritability in some kiddos, and too little will be completely ineffective. The timing, the dosing, the combinations are things that really do matter. And me as the coach know these things and work on these things. Again, very individualized. We also need to address the whole picture, right? And so MTHFR helps support what works best for our kiddos, but it's part of the comprehensive approach, which includes gut health, nutrition, toxin reduction, and stress management. If you're watching this and thinking, gosh, that sounds like my child, then you probably should be investigating it further because MTHFR variants are very common and the symptoms can be quite debilitating when they're not properly addressed. But here's what I want you to understand. Just think about this. If your child does have an MTHFR variation or a gene mutation, it doesn't mean it's a life sentence. Because with the proper support, these kids can actually thrive. And I see it every single day in my practice. So if you'd like to explore whether MTHFR variants could be affecting your child, I can offer a comprehensive psychiatric functional approach consult and look at the whole picture, the genetics, the biochemistry, the environment, the function, the nutrition, all the things with your kiddos. You can book a consult with me through the link in my bio, or you can get a hold of me through my website. I would love to work with you. And if you're thinking that you would like to really get to the root cause of things, I would love to get to that with you, with your child. Remember, if your child is struggling with focus or mood or sleep or behaviors, it may not be a character issue or something they're going to grow out of. It might be their body asking for the right biochemical support. MTHFR variants are very common. They're very treatable. And when they are properly addressed, we can see dramatic improvements in how your child feels and how they function. And so if you found this video helpful, please give it a thumbs up or subscribe for more content about functional approaches to help child mental health. And if you know a parent who might benefit from understanding MTHFR, because it's super complex and can be very overwhelming and intimidating, please share this video with them. And thank you for watching. And remember that there are answers to your child's struggle, and sometimes we just need to look deeper with them. So I am super excited to see you in the next video, and I hope you guys have an amazing day.